seminar is Troubled Veins, No Problem. It's my pleasure to turn to your presenter, Dr. Frederic Bahnson, General Surgeon at Samaritan Albany Surgical Specialists.
Hi, everybody. I'm Dr. Bahnson, and I'm a general surgeon here in Albany. And a good portion of what I do, I see a number of people who have vein disease or have leg discomfort and issues that can sometimes be helped by treating veins. So we're going to talk about what some of those issues are and how we can help prevent them or treat them once they've happened. I'm also going to give my little disclaimer with bearing with us with our technical stuff here. Amanda's going to be doing these slides, so you might hear us back and forth a little bit. And you can go ahead, Amanda. Next slide. So what we'll talk about today is what are the symptoms of vein disease and who are the people who are likely to experience those symptoms. And we'll talk a little bit about why that happens so you can understand kind of the background, and that background information then leads us into talking about what can be done both for prevention and for treatment. And then we'll talk very briefly at the end a little bit about how that treatment works and what to expect if you come in to talk about these issues with any of us. You can go ahead, Amanda. So, quick summary, the symptoms of vein disease, pretty common things. And as we'll find out, we'll talk a little bit more about, these are pretty common issues to have. Leg or ankle swelling, particularly swelling that gets later in the day, gets worse later in the day. So end of the day, you notice ankles and feet really swollen, feeling heavy. Early fatigue that you just don't understand in your lower legs, that can relate to vein problems. As it gets more advanced, it can cause pain. Usually not a really specific spot, just kind of a dull ache, throbbing, or burning in the skin sometimes, real hypersensitivity with itching that goes along with that. And Amanda, can you click one? So one, yeah, so then as that progresses, those issues in the tissue of the leg can lead to skin discoloration. And then click ahead again. Then, and as those veins get bigger and more problematic, you start to see them, and you see these little spider veins, which are pretty common, and then bigger varicose veins that people see are also common as this progresses. And then in the worst cases, this can get to the point where the tissue is so damaged that it starts to break down and people get wounds and skin breakdown. You can go ahead and click ahead. There's a small wound there and bad discoloration. So who is likely to get this problem? It turns out a lot of us. So about a quarter of adults will have vein problems if we look carefully, ask the right questions, or check with an ultrasound. It gets more common as we get older. Stuff just doesn't work like it used to. It's much more common in women than in men, but fairly common in both. Hormonal changes have a lot to do with that. Estrogen causes some tissue relaxation, which you'll see how that can affect the veins. Pregnancy can be a risk factor, both because of the hormones involved and also just because of the pressure of a pregnancy in the pelvis compresses the veins in the torso that the veins in the leg are trying to drain back into. And so that can increase the pressure in the leg veins, which can further damage them. It's also really common that this runs in families. If both your parents have it, you probably will too. If even one of your parents has it, your chance of having it goes up. And then another thing that's quite common and associated with this is obesity. And again, this is kind of like the pregnancy thing, which is when you lay down flat at night, if you have a lot of pressure pushing down on the veins in your torso and your pelvis, then it takes more pressure in the leg veins to keep the blood flowing. So all of those things together are risk factors. So I'm going to jump back a little bit. What are veins? So blood vessels, some people know a fair amount about this. Some people have never really thought this through or had it explained to them. So starting at the beginning, you can see in the lower diagram there, arteries bring the blood from the heart out to the tissue. The arteries are high pressure. The heart is a muscle. It pumps the blood into the arteries. The arteries have muscle in the wall. It keeps everything flowing really well. And then that blood flows through the capillaries, the small blood vessels in the tissue. That's kind of like pushing it all through a sponge. Just as much comes out on the other side and gets collected in the veins, but it's not under much pressure anymore. So then the question is, how does that blood get back through the veins into the heart? And if you click 1, Amanda, actually, why don't you go ahead and click 2 here. So veins have valves, and as the fluid collects in the veins, it gradually makes its way back towards your heart and keeps moving in the right direction because there are these one-way valves that keep the blood flowing in the right direction. If you click ahead one more, the pump that makes those valves work is the muscles squeezing on the vein. And you'll see here in this diagram on kind of the right side there, there's a deep vein and a shallow vein. And there are kind of systems in the deep tissue and the shallow tissue of veins that both flow back towards the heart. One more. So when that muscle squeezes, that lower valve down there stays closed. And the only valve that opens is the valve going back towards the heart. So this is when I was mentioning earlier, walking can help, and being active, being up and moving. So when your muscles work, they squeeze the veins, and because of the valves, that squeeze pushes consistently in one direction, which gets your blood back towards your heart. So most of us know that our heart pumps our blood. Most of us don't think about the fact very much that it's not the heart that pumps the blood back to itself. It's the rest of our body and using muscles and being active that actually gets the blood back to the heart so it can keep circulating. So how does this go wrong? Those valves are thin, floppy bits of tissue, and over time they have a tendency to break down. And when they break down, that blood flow can go in the wrong direction, and then it takes more and more pressure building up in that vein to get the blood back to the heart. Go ahead one more, and then that extra pressure stretches out the vein. And so you take a normal vein, like on the left of that diagram there, and as it stretches, as it gets more pressure in it, it stretches, it gets curved and lumpy, and if it's near the surface, you start to see it, like that leg picture at the bottom of the screen there. That is a varicose vein, and that's just a vein that's been stretched out because the valves aren't working and it's overpressurized. And then you can imagine looking at this diagram down in the bottom, if on the right side in that blue vein, that pressure is really high, it takes more and more pressure to get the blood to flow through the tissue from the artery. So as the pressure in the vein goes up, the pressure in the capillaries and the small vessels also goes up. Then what happens is those small blood vessels just have these thin little walls, and as the pressure goes up enough, fluid starts leaking out through the walls. And you can kind of anticipate where this is going here when we talked about the symptoms: swelling, itching. So when we get fluid that leaks out through the walls, it's not leaking out into the outside world, it's leaking into the tissue around that small blood vessel. So again, that's kind of a trophy-sized varicose vein there, but it's a great example of what happens when a valve near the top of the thigh stops working and all the valves along the way fail as well. And then you get these huge stretched out veins. And then, like we were talking about, I think we can click through this pretty quickly here, Amanda, that slow blood flow causes decreased oxygen delivery, causes swelling, and that swelling, that fluid in the tissue, if you can imagine, the cells are normally connected to one another. And when fluid leaks into the tissue, those cell-to-cell connections get broken. And that's trauma. It's microscopic, but it's damage to the tissue. So your body tries to fix that, and it sends extra cells in. You have inflammation, your response to an injury. Now you have scar tissue forming between those cells. They don't work together as well anymore. That inflammation causes burning, itching, skin changes, and if it gets bad enough, ulceration. So all of this comes from, in the background, the pressure building up because the valves aren't working and the blood's not getting pumped out of the leg. So what do we do for it? Well, sadly, but as we all have come to realize probably many times in our life, you can't go back in time, but we can slow things down or stop them from getting worse in the future. So staying active, using those muscles, walking. This doesn't have to be intense exercise. It's using the muscles. Compression stockings, we'll talk more about why that helps and what to know about them. And then if you're having symptoms, compression stockings, and then also getting rid of some of the leakiest veins. And yeah, I threw that in there to remind me to say, yeah, wear compression stockings and walk. This is the most important thing. Go ahead. And then, like I was talking about, and I keep coming back to this but it's a simple thing that we don't think about very much. You don't need to run a marathon. And also, the most intense workout in the world doesn't help your veins work much if it only lasts for 45 minutes and you spend the rest of the day sitting. It's breaking up your day with getting your blood moving. So not that it moves a ton for 1 hour, but that every hour you get up and you move around, you use your legs. Again, you don't have to go sprint. You just got to go take a walk around the block. You got to get up. I'm giving this presentation at my standing desk right now because when I move my legs more, I feel better at the end of the day. I also have my compression stockings on because I spend a lot of time on my feet. And so these are the things. So stay moving. And then there are other simple things that slow the blood down. We can't actually be on our feet all day, but when we do take a break, crossing your legs, especially those really tight crossed legs, really up high in the thigh, you're compressing those shallow veins and letting the blood out of hanging your leg off an edge, then you're compressing all the veins in the back of your leg and not letting the blood flow back up towards your torso and to your heart. So try to stay moving. Don't sit around with your legs crossed, particularly dangling them off the edge of something hard. And then I mentioned compression stockings. Compression makes the pump more effective. If you think about when that muscle contracts, it squeezes the vein that's inside the muscle. But the shallow vein isn't inside the muscle. It's just under the skin. And so it has a tendency to just kind of bulge outward and then flop back inward as the muscle contracts and relaxes. But if you put a compression stocking on outside of that, then when the muscle contracts, it has something to push against. So even those shallow veins get better pumping action when you're wearing compression stockings. We do have some thought that the compression stockings may help some of those leaky valves work better, which would also be a great help. We don't know exactly how well that works, but we know that it may help a little bit, and definitely the pumping action works a lot better with compression stockings. Most people that have symptoms from varicose veins, most people, most of their symptoms are down low in their leg. Some people get some thigh aching, but for the vast majority of people, knee-high stockings are plenty. There are thigh-high stockings out there. They're tight, they're hard to get on, they're hard to get to fit right. If you need them, you should be working with somebody or a clinic who can help you get the right fit and work through some of the hassles of using them. But it's far better to be using knee-high compression consistently than to try to wear thigh-high because you think it's going to be even better, but end up not using it consistently because it's a hassle or it doesn't fit right. So knee-high compression. And then more is better up to a point. At some point, compression becomes a tourniquet. So for the vast majority of us, we can tolerate quite a bit of compression. But if you know you have problems with your arteries, or if you put compression stockings on and then you get severe leg cramping, take those stockings off, because aren't getting blood down to the leg effectively, then you're not going to be able to put a lot of compression on without cutting off the blood flow completely. Now, again, this is uncommon, but you got to know, you got to be aware that it's out there. When you put compression stockings on, they should feel tight. That's how you know they're working, but they shouldn't make your legs hurt. You shouldn't have cramping, and you shouldn't get pain that gets worse over time. So how tight is tight enough? If you go to buy compression stockings and they don't have a number on them, like 20 to 30, if there's no number, they're no good to you. You don't know what they're doing. All of them will have a range. So they're graduated compression. It starts tighter and gets looser so that you keep things flowing in one direction. So 20 to 30 or higher is medical grade compression. That's that. And then this, you can click ahead to, yeah, and one more. So there are all different kinds of compression stockings out there. 20 to 30 is medical grade. You can get these other things. They're easier to get on, but they're correspondingly less effective. If you're symptomatic from vein disease, you want to wear at least 20 to 30 if you can tolerate it. Click ahead one more. And then one thing to know is if you're having significant symptoms, you can get 20 to 30 over the counter. That's great. Get started wearing compression and walking, and then come see somebody. And depending on what we see with the ultrasound and a discussion about your other circulation, we may give you a prescription for an even tighter stocking. But that's not necessary to get medical grade results. You can get the 20 to 30s over the counter or online. And then consistency is key. That damage I was talking to in the tissue, where those cells get pulled apart and the inflammation comes as part of healing that trauma, that doesn't get better one day and then stay better if you don't wear the stockings the next day. It takes a long time for that to heal, and it takes consistent use for it to stay healed. So we want wearing compression, putting it on in the morning, wearing it all day, taking it off before you go to bed, putting it on the next day. So walking consistently, compression consistently. As medical treatments go, you know, as a surgeon, there are a lot of things I do that are a lot harder for people to deal with than me telling them to wear tight socks. So it's pretty good. You can go out over the counter, buy medical grade treatment for this really common disease, but it only works if you use it consistently. So if you're wearing compression and you want to know how can I get more out of it, how can I get more than the compression gives me alone, then we can do some treatment. And the treatment relies on a fact that I didn't mention earlier, but I did mention that there are deep veins and shallow veins. It turns out that about 90% of the blood flow comes back through the deeper veins, but roughly you could say about 90% of the symptoms that we get from vein leakage is from the shallow veins. So it turns out we can actually just get rid of some of the most problematic veins, the leakiest veins you've got. And actually, by getting rid of those blood vessels, we improve the circulation because we decrease the back pressure, and the deep veins have more than enough capacity to handle the extra flow with fewer problems because they're down buried in the muscle. So there are different ways we do that. You can click ahead to the next slide, Amanda. And one of those ways is with an injection of, there are a number of different things that we can use that basically just causes scarring in the vein and closes off some of the vein. And this works really well for small veins. It can work well to close if there are problematic connections between the deep vein and the shallow veins, but doesn't work well for the big veins that are the major problem. This, if it's going to get used at all these days, is used primarily for cosmetic stuff. After we treat the big veins, if some of these spider veins are still visible and you want to go back and inject them to try to make them a little less visible, that's something that can be done. But like I was saying, this is not the treatment we want for the bigger veins. This is one of the treatments for the bigger veins, which is you go in and actually take out that shallow vein. And this used to be the way to do vein surgery, to get rid of problematic veins. It involves, it's tiny incisions, but you have to make a bunch of them. And we take out a few centimeters, an inch or two of vein at a time, all up and down the leg, and just get rid of some of those leakiest veins. That forces the flow through the deep veins, and a lot of the varicosities will get decompressed. That swelling will decrease, itching and aching will go down. People with wounds heal faster and have less wounds in the future. So this is really effective. It's also a tough recovery. It's a lot of bruising along where we took that vein out. Those incisions are small, but you can end up with 20 or 30 of them. And so people go away from this feeling like their leg's been pretty beat up. They're pretty sore for a week or two. They get a lot of bruising. Effective, but it turns out we have better ways to get equally good results now. So we can go ahead. So this is one of those ways. What's pictured here is a radiofrequency catheter, which is basically a heating element. And instead of making 20 or 30 little incisions, this uses one small incision. It's about 3 or 4 millimeters across. And kind of like putting in an IV, we put a little catheter into the vein and thread this thing up inside the problematic vein. And then we numb that vein up and close it. It heats up, it seals the walls of the vein to itself. And then that vein doesn't leak anymore because it doesn't have flow through it anymore. You can go ahead and, yeah. So that catheter goes up inside the vein. We put a bunch of numbing medicine along both sides of the vein, which actually compresses the vein against the catheter a little bit and makes it so that you don't feel any of the procedure. And then we heat it up and that vein is gone, no longer a problem. So that's very effective. It has minimal recovery. People do bruise up a bit, mostly from the injections of the numbing medicine, which ironically turns out to be the worst part of the procedure, but nothing compared to the recovery from the older version of the surgery. The last time when I gave this talk a couple of years ago, this was kind of where I stopped. But we have a new way of doing this that's even, if this was a leap forward from the old surgery, we've made another similar sized leap forward, I think. And if you go to the next slide, and this is glue. So instead of cauterizing that vein to close it, for most people, we can now glue that vein shut. This uses a glue that's actually been in use for many years, probably over a decade now, in brain aneurysms, actually. So we know it's safe. It's, like I said, been used in the brain for many years, and now a couple of years ago was made available to us for treating these bigger veins in the leg. We have a catheter that's long enough and works for putting it into these leg veins, and then we can compress that vein and glue it shut without the heat, which also means we don't need the numbing medicine, and we can treat more veins because we can go into veins or parts of veins that are close to nerves and other things, because we don't have to worry about damaging them with the glue like we would if we were using the heat to close the vein. So this has been another leap forward, I think, in how easy it is to treat these veins and how much easier it is for the patient to recover afterwards. So if you think, gosh, my ankles do swell, or man, the skin started to change color. I'm in the early to mid stages of having vein problems myself. Should come talk to us. And this is what to expect at that visit would be, you come in, we're going to talk about your circulation, both sides of it. We're going to talk about the arteries and the veins. We're going to check some pulses. We're going to look at the veins. We may do a little bit of ultrasound in our office, depending on which office you're in. We'll probably send you to the radiologist and an ultrasound tech who can do a very detailed evaluation of mapping out those veins and which valves are the leaky ones. And that kind of gives us our roadmap for what we're trying to treat. Before we send you out to the ultrasound though, we're going to get you measured. And if you're not already using compression, we're going to get you started on that. And at least start the conversation to say, well, would doing a vein closure make a big difference for you? And for some people, it's not worth doing. For a lot of people, especially with the newer treatment, there's so little recovery from that procedure that if we can make compression more effective by closing the vein, that's worth doing. So if you do end up getting a vein closure procedure, you end up being at the center for an hour and a half or 2 hours, but the procedure itself is pretty straightforward. Most of that time is spent just getting you ready, making sure everything's sterile. We use an ultrasound during the procedure to verify where the catheter is and make sure we're doing exactly what we intend to and no more, no less. Once the vein is closed, you put essentially a small Band-Aid over the access site, and then you do, at this point, get a thigh-high compression wrap that goes on at the end of the procedure. And then when we're done, you walk out and you can go back to normal day-to-day stuff. That compression wrap will stay on for 2 or 3 days, but with it on, like wearing a high stocking, you can go back to normal activity pretty much immediately. You may have a little bit of bruising and aching along that treated vein. Most people say, yeah, I noticed that, but I didn't have to do anything for it. Some people use some Tylenol or ibuprofen or ice or some combination of those. But this is not a major recovery. And then usually for most people, if you have leaky veins on one side, you have leaky veins on the other. And so we'll usually plan on doing the other leg within a few weeks once we get the first one done. So for the future, this slide used to have the glue on it, but now that that glue is a reality, it's become more available. Most insurances are covering the glue now, not all of them, but that is becoming easier and easier process to get people approved for the glue. The radio frequency is still available even for those who can't get glue coverage, and it does a super effective job. And you just have a little bit more of that bruising and aching for a few days to a week or so. But the process is very similar. You walk out under your own power the same day and are back to normal activities either the same day as your procedure or the next day. So for the future, compression is just becoming easier to get. They're still not the cheapest socks you'll ever buy, but they are some of the cheapest medical treatment you'll ever buy. Because honestly, it's just not that much to do. It's a tight pair of socks, and if you wear them every day, the price is coming down. The styles and variety are more available. Once you know what size you are, you can order them online and they've become, like I said, even more available and less expensive. And I expect the availability of these closure techniques to just become easier and easier for more people to get access to. So I think, oh yeah, then there's the summary. So the veins bring the blood back to your heart. When they don't work, you can get swelling, it hurts, and in the worst cases, you get ulcerations. What people notice often first is they'll notice the varicose veins. You can click ahead a little bit, Amanda, these just highlight. And then moving helps, compression helps moving work better. And then having symptoms, treating the most problematic veins with a vein closure can really make a big difference for you and prevent things from getting worse. And in most circumstances, make them feel quite a bit better. I think that's it. I'm gonna pop open the chat here. And if anybody has any questions, you can raise the hand on Teams or type something into the meeting chat if you want to do that.
So Sheila, she has her hand raised. If you want to go ahead and unmute yourself, please, and ask your question.
Can you hear me?
Yes.
Great. What about all the little broken veins in the ankle and the foot? Is there any treatment for that?
Yeah, good question. So it turns out we generally don't treat those directly until kind of a second phase. The reason being, if you just go after the small veins, they tend to either open right back up because there's so much pressure in the bigger veins flowing backwards into those small veins, or the vein right next to the one you treated just swells up and becomes a problem. So usually we'll treat the biggest veins first. As the biggest vein and the problems from it go away, a lot of those small veins will decompress. So they'll become a lot less visible. Sometimes that's all you need. If there are specific veins that are still problems, either cosmetically or just they're swollen and still causing a really localized set of symptoms, then we can go after those specifically, either with some of that injection therapy I was talking about, or a really limited version of kind of the old school surgery, a couple small incisions and just removing whatever segment of problematic vein is left.
Thank you.
Yeah, of course.
Looks like we have Sabina with her hand up.
Yeah, hi, can you hear me?
Yeah.
Good. So I do, when I, wear compression socks, I often get ice cold feet, and I already get ice cold feet and hands a lot. So that's kind of my problem with wearing compression socks often, that they're getting even colder.
Yeah, so to me that sounds like you may be right on the borderline of having enough pressure in the arteries. If you're someone who had really cold feet even before you started wearing compression, you may be, and that can be from several reasons. You can have narrowing or blockage in the arteries. You can also just have, it can also be from fitness and having a low blood pressure. And so there's not a lot of flow going all the way down to the feet. It's enough, but there's not enough extra that with a lot of compression, enough gets through. So I would say one thing to try is going down one step, whatever level of compression you're using, try going down one step and see if that makes a difference. The other thing I would say is come in and let's check what those pressures are, and then we can make a really specific recommendation about how much compression to use. And you might be someone who would benefit from a vein closure because
I did do that.
Yeah. So, and that can allow you to kind of use a lower level of compression and still get the same result because those leakiest veins aren't there anymore.
Okay. Thank you.
Of course.
Great, thank you. It looks like we have Igel, and I'm going to spell it because I'm not sure if I'm saying that correctly. E-I-G-E-L.
It's Igel. Can you hear me?
Igel, yes, got it.
So my dad wears 20-30 compression stockings, and he said he can't lay down for naps because his legs cramp. Is that because of the stockings? You had said something about cramping.
Yeah, so that would worry me, that he's also kind of right in that borderline. And when he's got gravity helping him, get blood down to his feet, that there's just enough pressure to overcome the compression from the socks. But when gravity's not helping him anymore, he reaches the point where there's not enough blood flow getting to the legs. And so again, he's one that I would recommend come in and get checked out so that we can check the pressures on both sides of the circulation and try to figure out kind of a safe package of compression and other treatment to get the most out of the vein treatment without putting the circulation at risk.
So does he just call your office and
yeah, or the vein center over in North Albany, the Wound and Vein Center there, and we'd be happy to see him either way here in our Albany surgical office or over in the Vein Center. It's the same docs that work in both places, and we're all set up to get that sorted out.
Okay, I was just wondering because the one who first recommended, so he's been doing it for years.
Yeah, okay. And that's but if he's having cramping with that sounds like he's kind of, like I said, just right on the borderline of too much compression, and you want to get close to that. You want to use as much compression as you safely can, but particularly as we age, our circulation tends to get worse, and you don't want to keep using that compression if the artery side of the circulation is getting worse and now it's becoming not enough pressure to overcome the stockings.
Okay, well, I have your telephone number because you performed surgery on me last year, but do I call, so I need to call the vein center or just you?
No, you can call the office over here and we can sort it out, and depending on the details, we may end up scheduling him here in the surgery office or over there in the vein center, but you could just call my office here and we'll get him set up.
Okay, well, thank you. I appreciate it, Dr. Bahnson.
Yeah, of course. Happy to.
Okay.
So we have 2 more hands raised, and I think just enough time to answer those 2 more questions. So the next person is Kath, K-A-T-H. If you want to go ahead and unmute yourself.
I'm sorry. Over the last year, I've developed like a varicose vein on my lip. Is there something that can be done for that? I'm afraid my tooth is going to catch it.
So that is probably a different type of thing. That's something to probably talk to an ENT surgeon about, to take a look at the blood vessel.
Okay, thank you.
Yeah, it turns out we can't treat that with compression.
It's okay. I'm going to get this. If you don't have a lot of varicose veins on your legs, but some, should you go ahead and just wear compression stockings?
I think so.
Okay.
Yeah, if you can safely wear them. This problem is so common, but also so easily treatable, or so easy to slow down as long as you catch it early.
Okay, so, thank you very much.
I definitely recommend compression for almost everyone.
Okay, thanks.
All right, we'll go ahead and take the last question here, which is Danelle, D-A-N-E-L-L-E.
Hi, I have kind of an unusual question. My varicose veins are mainly, so the swelling occurs mostly on the left side, and I have very few on the right. So Would compression work for that since they're both the same strength, or?
Yeah, generally I would say use compression on both legs, because most people who develop varicose veins or symptoms on one side eventually will develop them on both sides, and so you can slow the progression on the other side right now. And you know, if you find that it's uncomfortable, difficult to wear, it's not ludicrous to do it on just the leg that's symptomatic. But for the most part, I'm going to say you're probably better off in the long run if you just wear the pair.
Okay, most of the swelling is actually on the inside of my knee, so it would be above, I would think, what a knee-high stocking would be. Is that still a good thing to wear?
I would generally still start with a knee high, and you may find that it improves the circulation below the knee enough that some of the symptoms at the knee and in the thigh go away. But you may be one of the people who would benefit even more from a thigh high. But I would recommend starting with knee high and give it a try. Don't expect it to be a miracle cure overnight, but do expect that if you wear it consistently for a few weeks, you should notice a pretty big difference from the few weeks prior.
Okay, and would it be a good idea just to come in and be checked? And do we need a referral from our primary care to come see you?
Most do not. That tends to be an insurance specific issue, so I can't definitively answer that. But for most people, you don't necessarily need a referral. You can just call, we'll get you in, and if that is going to be an issue, we'll catch that ahead of time. We screen for that, and we'll let you know if we need a referral.
Okay, thank you so much for all the information.
Yeah, my pleasure.
All right, well,
right on time.
Yep, right on time. Thank you again, everybody, for joining us today. I have placed a survey link within the chat area. If you could please take a moment to fill that out. Your feedback is extremely valuable to us. And then, as I mentioned in the beginning, a link to the recording will be sent out via email after the event. So do watch for that to arrive. And then for anybody interested in other upcoming events offered through our Healthy Minds, Healthy Bodies seminar series, we do have Joint Replacement, Is It Right for You, on Friday, this Friday, November 13th, which will start at 12:15 and go until 1 p.m. Again, thank you everybody for joining us today. And if you could please take a moment to fill out that survey, that would be much appreciated.
Thanks, everybody. Have a good afternoon.